Medevac 2, Bravo Mike, fly around hangar 3 for left, clear for takeoff.
Clear for takeoff, 35 left, and runway heading Medevac 602, Bravo Mike.
Founded in 2019 with the goal of providing safe, reliable, and affordable air ambulance service to eastern North Dakota and western Minnesota area, Altru Care Flight is a Federal Aviation Administration 14 CFR Part 135 certified air ambulance provider. Based at the Grand Forks International Airport, Care Flight operates two modern Pilatus PC-12 single-engine turboprop airplanes, capable of cruising at speeds of over 300 miles per hour with a service ceiling of 30,000 feet and the ability to operate from relatively short runways. The PC-12 is an ideal aircraft for North Dakota-Minnesota region. The airplane carries advanced life support and communications equipment, including cardiac monitors, defibrillators, suction, oxygen, and sat phones. Providing service to over 200,000 residents of northeast North Dakota and northwest Minnesota, Care Flight reduces traditional ground ambulance transport times by an average of 80%, while releasing ground ambulances to respond to local calls for service. Care Flight's flight crew consists of Federal Aviation Administration certified commercial pilot, flight nurse, and flight paramedic. Care Flight's 5 pilots, 8 flight nurses, and 7 flight paramedics work rotating shifts to provide 24/7 coverage, 365 days per year. Flight crew members adhere to a strict maximum duty hours and mandatory rest periods to ensure that they are well rested and capable of operating at peak performance. Pilots receive their initial and recurrent Pilatus PC-12 training at Flight Safety International. Flight nurses and paramedics are selected from a pool of highly experienced candidates and undergo advanced critical care and procedural training on a routine basis. In addition to transporting adults and children, Altru Care Flight transports premature infants known as Neonatal Intensive Care Unit, or NICU patients. NICU patients are transported in a specialized neonatal isolette that provides a closely monitored and climate-controlled environment for the newborn infant. On these flights, the flight nurse and flight paramedic are accompanied by a neonatal intensive care team consisting of 2 nurses and a respiratory therapist who specialize in the advanced care of premature infants. Care Flight provides 2 types of transport flights, on-base and off-base. On-base flights involve the transfer of patients from Altru's Grand Forks Hospital to facilities that can provide specialized care, or when there are no beds available at Altru's Grand Forks Hospital. Frequent destinations include St. Paul Holman Field, which provides access to several Minneapolis and St. Paul hospitals, Fargo Airport, which provides access to Sanford and Essentia hospitals, and Rochester Airport, which provides access to the Mayo Clinic. Off-base flights generally involve transportation of medical and trauma patients from smaller medical facilities located in a wide range of North Dakota and Minnesota communities to larger medical facilities located in Grand Forks, Fargo, Bismarck, Minneapolis, and Rochester. While these are common examples of origins and destinations, Care Flight has provided flights to more distant locations, including Denver, Colorado. Care Flight utilizes Flight Vector, a commercial aeromedical dispatch system utilizing cellular phone technology to alert flight crew members of a pending flight.
Altru 1 call.
The Flight Vector dispatch is initiated by a team of specially trained registered nurses that staff Altru 1 Call Center. Altru 1 Call Center staff evaluate the transport patient's needs, aid the transferring physician by facilitating the most appropriate type of transport, ground or air ambulance, arrange for a receiving physician and a bed at the receiving facility, and, if air ambulance transport is selected, coordinate ground ambulances for transportation to the departure airport and transportation to the receiving medical facility at the destination airport. Pilots normally respond from their home, while flight nurses and paramedics respond from Altru's Grand Forks Hospital. Pilots conduct a weather check, consult with a pilot manager on duty to compare notes on weather and notices to airmen, and file an Instrument Flight Rules flight plan. The pilot and the pilot manager on duty must agree that a flight can be conducted safely. If either believes the flight cannot be made safely, the flight is canceled. Weather checks and flight plan filing are most commonly accomplished by utilizing ForeFlight flight planning software. Upon arrival at Altru's Grand Forks Airport facility, the pilots conduct a pre-flight inspection of the aircraft and utilize an electric tug cart to move the airplane from the hangar to the ramp. Flight nurses and paramedics, and a patient if it's an on-base call, are transported from the Altru Hospital to the Grand Forks Airport in an Altru ground ambulance, utilizing emergency lights and sirens to expedite the transfer. When the ambulance arrives at the airport, the flight crew and ground ambulance crew work as a team to load the patient into the aircraft. The aircraft doors are secured and the pilot conducts a pre-takeoff briefing with the crew. Any passengers, including the patient, are provided a standard safety briefing. The pilot obtains an instrument flight rules clearance utilizing the specialized call sign Medevac.
Good morning, Ground Force Ground Medevac 602 Bravo Mike is Alpha Apron Information Foxtrot taxi for takeoff.
Medevac 602 Bravo Mike, Grand Forks Ground, runway 35 left, taxi via Alpha 4 Alpha.
The Medevac call sign alerts air traffic controllers to the nature of the mission and imparts air traffic control priority to the flight. Usually ascending into the flight levels, altitudes above 18,000 feet, the crew and passengers cruise in pressurized, climate-controlled comfort to the destination airport. State-of-the-art navigation systems, 3-axis autopilot, and onboard satellite, weather, and radar assist in ensuring the safety and comfort of the patient and crew throughout the flight. Upon arrival at the destination airport, the CareFlight Air Ambulance is met by a local area ground ambulance and crew. The patient is quickly transferred to the ground ambulance and transported to the receiving medical facility. The flight nurse and flight paramedic accompany the patient during the ground transport and, working with the ground ambulance crew, continue to provide advanced life support services. Off-base flights are conducted in a similar manner, with the exception that the flight crew ferries to the airport near the discharging medical facility in the air ambulance and is met by a local ground ambulance crew. The ground ambulance crew transports the flight nurse and flight paramedic to the discharging medical facility. Upon arrival, with the assistance of the medical facility and ground ambulance personnel, the flight crew evaluates and packages the patient and utilizes the ground ambulance service to transport the patient to the local airport. Flight and ground crew members work together to load the patient into the aircraft. Upon arrival at the airport near the receiving facility, the air ambulance is met by another ground ambulance team for transportation of the patient to the receiving facility. Upon completion of all flight legs, a comprehensive debrief is conducted with an emphasis put on safety-related items between the flight crew and one-call personnel. Any areas of concern are followed up on and resolved by CareFlight management personnel. Altru aircraft are maintained to the highest standards by a dedicated Altru mechanic supported by a nearby Pilatus factory service center. While challenging and sometimes intense, work as an air ambulance flight crew member is satisfying and rewarding. Compensation and benefits are excellent. For further information on Altru CareFlight services and employment opportunities, contact Altru CareFlight Management at careers@altru.org. Healthcare providers can request an Altru CareFlight Air Ambulance by contacting Altru One Call at 855-425-8781.